Welcome back to Exposing It All podcast. Tonight we're going to talk about one of my favorite subjects, bariatric surgery. If you didn't know, you're going to know. I had bariatric surgery about 11 years ago, 12 years ago. It was July 29th, 2013. That's when I had bariatric surgery. I remember the day I was first informed about bariatric surgery. I actually didn't even know what it was. David and I were trying for a second child, and we had been trying for 6 years. Bariatric surgery was recommended because I had polycystic ovarian syndrome, also known as PCOS, also known as insulin resistance. If you don't know about that, I will talk about that a little more later. A quick Google search will tell you a little bit more about that. It's very common in women. It's also very common in America because it really has a lot to do with diet. Some people think it's a hereditary thing or a genetic thing. It's a lot to do with diet. And it is reversible and curable. You don't have to be on medication for your whole life, and you don't have to have bariatric surgery. So I'm going to tell you that right up front as well. But mine was pretty severe. I had pin-sized cysts all over my ovaries, so they couldn't actually be removed. I had one rupture when I was as young as 12 during Thanksgiving. I was very sick, and that's when I got my official diagnosis of polycystic ovarian syndrome. I was sick, and I remember my mom taking me to the hospital. I couldn't eat Thanksgiving dinner, and that's when I got the official diagnosis of PCOS. Anyway, we were trying for another baby, and I remember them recommending bariatric surgery. I had never done it for weight loss to begin with. But of course, when you have PCOS, what's the first recommendation? Metformin. They put you on the medication. They want you to lose weight. And they're like, if you lose weight, you're probably going to get rid of PCOS and you're probably going to get pregnant. So I'm like, cool, let's do this. So of course I had been dieting since I was 8 years old. Okay. I always tell people I was an obese child. I was a near 10-pound baby. And I had been dieting since I was 8 years old. I had done Jenny Craig, Richard Simmons. My mom let me take a half a fen pill, which was later taken off the market. I was 10 years old taking fen, okay? I was even taking the little blue pill that was supposed to eliminate fat in the bathroom. And it did. Let me tell you, it was kind of scary the first time I took it. Okay, TMI, gross, but it was a blue and white pill, and it might have even been phentermine. I don't even know, but I remember it was supposed to eliminate fat that you ate. I remember my mom let me take those. I did Slim for Life. I did Weight Watchers. I did everything out there that you could possibly think of, and I started when I was 8 years old. And my mom would always take me and allow me to try everything possible because I struggled with my weight my entire life. So I had been doing diet, exercise. I played baseball. I played basketball. I was an active child. It wasn't that I was inactive, but I will also tell you, when I look back, we didn't have the best diet. We ate a lot of Mexican food. We also had Hostess cupcakes and Twinkies. And my mom was type 2 diabetic, so there was candy in the house. I used to think we had a lot of home cooked meals. We didn't eat out. But I mean, when I think about how we cooked and what we ate, maybe processed food back then wasn't as processed as it is now, but it wasn't as wholesome. I mean, we did eat at home, but probably wasn't the best for us. Long story short, I probably was obese for a reason. And I don't always like to admit that, but I know now. If I would have known all that I do now back then, bariatric surgery would have not been my first choice either. So I also want to say that. Anyway, bariatric surgery. We tried for 6 years after our first child to try to have another. We were told, maybe bariatric surgery because it may reverse or cure the PCOS. When I heard cure, I was like, what? Because PCOS comes with a lot of really terrible symptoms. Irregular cycles and the whole nine. Like I said, a quick Google search. I don't want to go down the whole nine of what it does, but let me tell you, I had a terrible, terrible childhood when it came to PCOS because I had to be picked up from school more times than I can count from vomiting and accidents. Okay, let's just say that because it was so bad. And it was all due to the PCOS, like heavy flow. TMI for some people if you're watching. But it was bad and embarrassing. And it started when I was 8 years old. 8 years old. Okay. I have girls. Thank God we're not there. And they're like, they're at that age right now. And thank God they don't have to go through that. Like, thank God. But again, I think that's a lot due to diet, what they put in the food, etc. But I'm way more cautious with my kids and what they consume and what we put in our bodies, etc. Anyway, we're moving on. I didn't really know much about bariatric surgery when they first brought it to my attention. I had no idea it even existed, to be honest. I had heard somebody at our home church had bariatric surgery, but I had no idea what a gastric bypass was. I had no idea what a duodenal switch was. I had no idea what a lap band surgery was, a balloon in your stomach, because that was still a thing back then when I first heard about it. So I had to do some digging. I said no initially. I was like, no, absolutely not. I will not be a cheater. Absolutely not. Little did I know, it is not a cheat either. If you did it, I don't believe it's a cheat. I don't. I'm still living with it. It's irreversible. It is not a cheat. I will say that also. It is not a cheat. So I decided I was going to do some digging. After I did some work on myself, I started diet and exercise. I lost about 65 pounds of my own. Because of PCOS, I had gained approximately 19 pounds, I want to say 16 to 19 pounds. I can't remember the exact number within a couple of weeks because of my PCOS. It causes rapid weight gain due to the insulin resistance. And I remember stepping on the scale and I was 298 pounds. I thought I was going to have a heart attack. In fact, I always have had lower blood pressure, so much so that they make me sit down, stand back up, sit down, stand back up, because it's usually like 92 over 70, or 92 over like 68. Like, it's usually fairly low. I mean, 112 or 70, like the highest I've ever seen, but it's never like an average blood pressure. And that day I remember my blood pressure skyrocketing and it was like 180 over 110 or something like that. It was a crazy number. And I remember seeing 298 on the scale and I was like, what? And my doctor was like, well, have you reconsidered bariatric surgery? Like, now I'm concerned. Your blood pressure is also high. And I was like, I think that's because I freaked out. And the nurse even said the same thing. She's like, you never had high blood pressure. I think you were freaked out about the number on the scale. I was like, me too, because I never seen that number ever again after that day. But I said, yes, I would like to take the classes. So I went in, took the classes. I went in for the first 6 months of classes and then I backed out again. Well, after that, I struggled, trying to lose weight. And I'm just trying to make this story as quick as possible. Like it was a battle. I battled. I was 26 years old when I made the decision. Okay. And I battled with my weight and the obesity, and it was so hard. And I was not obese. I was not overweight. I was morbidly obese. Okay. And I was active. Like I said, I was active my entire life. And I hated it because we would go to the gym. David and I would go to the gym. We would exercise. We would diet. Like, I took care of myself. I was so cautious. Like, when we first met, he's like, I remember you and your organic food and your turkey burgers. Like, you ate so healthy and walking on your lunch. And I didn't see the results. It was such a struggle. And I remember taking the classes and going back. And I was like, no, it's a cheat. I can't do it. I can't do it. I can't do it. And then finally I was like, you know what? We're not going to do IVF, and I'm not going to get pregnant at 260 pounds or 290 pounds, whatever I was at the time. I was like, I'm not doing it. And he's like, you don't have to do bariatric surgery either. It's okay. We have one child. It's fine. And I was like, yeah, it is fine. But maybe I should do the surgery. Like, maybe I should, for my overall health. Maybe I should do the surgery. He's like, yeah, maybe, at least for your PCOS. And, if we get another baby, we both kind of really wanted that other baby. That was really our ultimate goal. And I was like, yeah, I really don't want to pay for I don't want to pay for IVF. IVF was so expensive, and anyway, we decided I was going to go through with bariatric surgery. I went for 2 classes to get the sleeve, the bariatric sleeve. And I went through a total of 9 months of classes, because after I backed out after the first 6 months of classes, I only had to take 3 months more because I had just backed out, and the doctor was like, I think you should come back, do 3 months, then we can go ahead and move forward with the surgery. So I took a total of 9 months of classes. Most people only take 6 months of classes. You see the psychologist, the nutritionist, etc. And I had just recently backed out. So I only had to do 3 months before I could actually set a surgery date and meet the insurance requirements again. So I did 3 additional months of classes, met the insurance requirements, etc. And my insurance, the day before or the day of, they had given me my approval and everything. This whole time, I have a binder. I actually still have them. I had a binder for the bariatric sleeve. Day of surgery, I signed paperwork for a gastric bypass. RNY surgery, or Roux-en-Y is how they say it. Gastric bypass. And I remember praying, and I was praying the whole time, and I was like, Lord, if this is your will for me to have this surgery, if this is your will for me to get better, if this is going to be the only way I'm going to have a baby, or even like get this weight off, get rid of this PCOS, like let your will be done. I remember praying over my insurance too. Like, I'm like, if it's meant for me to do this, like let my insurance prove it. And I remember my insurance covering the entire cost. I remember getting approval like almost immediately, even before people who had been in the class, like with my first group of classes. I got approved before them. And I remember like, okay, this is your will. This is your will. Like, it's going to be done. Like, I'm going to do this. Even though I was scared, I honestly was so scared of bariatric surgery, like terrified. And I went through with it. And I remember I had the best surgeon though. Like, I would recommend him to anybody. I don't recommend bariatric surgery, but I would recommend him if people are going to go through with it anyways and wouldn't listen to me. I didn't have any complications with my surgery initially. 10 years post bariatric surgery is when the complications came. My first year was great. You have restrictions, so of course you lose weight. I lost about 90 pounds in my first year. By 14 months post-op, I'd gotten pregnant. It was not planned that way because David and I had already settled, like, we're probably not going to have another baby, and that's okay. You know, like, you're losing weight, let's get you healthy. The PCOS was supposedly reversed. I gotten pregnant at 14 months post-op, which I shouldn't have. They say you should wait at least 2 years. But I had gotten pregnant. It was what it was, you know, and I took care of my body. I had only gained about 5 pounds throughout my entire pregnancy. And after I had her, I got pregnant at 6 weeks when she was 6 weeks old with another one. So during that pregnancy, I remained active. I followed protocol, etc. But I also found out in between those two pregnancies, I had cysts on my ovaries again, like really bad. I had like pin-sized cysts again, like really, really bad. So I had these PCOS symptoms too. It was really weird. And I was so mad because it was like, I thought that this was going to go away. Well, so I had my girls, and then I got pregnant again. Yeah. They told me I wouldn't get pregnant. I was going to die during birth. All these scary things. I almost died. I had to go to iron infusions because I was so deficient in everything. Because with bariatric surgery, deficiencies come. Vitamin deficiencies, iron deficiency. Your body, especially with gastric bypass surgery, that's the one that I had, your body no longer has stomach acids because they create a new pouch and then reconnect your small intestine at the bottom. So you have this little stomach. It's usually the size of an egg. I think when you first get out of surgery, it's the size of a thumb, and then it eventually is the size of an egg. And you have this little pouch. I've had it checked several times and I've never stretched it out. I'm really cautious of what I eat, how I eat. I still feel some restriction and know when I'm full. I actually start to sneeze. So most people know when I'm eating, once I start to sneeze, I'm full. And what happens is that little pouch hits your old, what they call stoma, so like your old stomach, and it causes you to sneeze because your ear, nose, and throat are all connected, right? So I sneeze when I'm full. And some people don't even know I had bariatric surgery, and they think like I'm just being rude and I don't eat food or I don't like food, but like sometimes they get full really fast, and then there's sometimes like I'm a bottomless pit. It's so weird with bariatric surgery. It's so weird. But I didn't have any complications until 10 years later. Then I started having severe complications with PCOS again. I started having severe complications with my pancreas. They didn't even diagnose me with anything. They just said that my pancreas is not functioning properly. I wasn't producing enough insulin, something with like my liver and the cells. Like they couldn't even give me a diagnosis. That's all. They told me that I was going to have to be on medication for the rest of my life. I was able to do some research and take some supplements and reverse that. I also was diagnosed with NIPHS. It's like non-insuloma pancreatic hypoglycemic syndrome. I can't pronounce the second word properly, but it is a very, very rare condition that can happen to either men or women who've had bariatric surgery, gastric bypass specifically, or you are born with it, with a condition. And it causes rapid blood sugar drops, very similar to hypoglycemia. They thought I was having like reactive hypoglycemic episodes, and that's what they kept saying was going on with me. Oh, you're just reactive, to certain foods, etc. And it took several years for them to actually diagnose me with NIPHS, which I've also since reversed. I also had, the iron deficiency anemia for several years, which I've also reversed. I have to be very cautious about the type of vitamins that I buy. I don't buy vitamins that have a lot of things in other ingredients because my body needs a way to absorb them. I prefer to do like liquid vitamins or find a gel capsule, like a bovine gelatin capsule that's going to dissolve quickly and allow the liquid to hit my stomach so my body will actually absorb it. And the one thing that I do struggle with to this day is getting my ferritin level up in my body, but the rest of my vitamins and minerals I'm able to control by making sure that I buy quality supplements. But it's been hard because I've gone through a lot of different things after having my children and seeing those deficiencies later. And they didn't actually hit me until 10 years later. I didn't have a lot of complications. I don't recommend bariatric surgery because I've learned a lot about health. And I think if I've had known everything I know now, I wouldn't have done bariatric surgery because I learned about food. I learned about having an actual relationship with food. And people think bariatric surgery is a cheat, and it really isn't. The first year you have no choice but to have like this restriction, right? You've had this major surgery. Your body has undergone a major surgery and you have this restriction to your stomach and you can't eat a lot. You can't drink and eat at the same time, and you can't put a lot in your mouth, and you're very cautious about what you eat. But a year or so out, you start to like, oh, a little bit of sugar. Oh, my coffee now. Oh, this. Oh, that. Oh, I can consume this. And people start to fall off. I'm a part of a lot of bariatric groups, okay? So many men and women struggle with regain, and that's why, because they never heal their relationship with food. And that is the biggest problem in the bariatric community is you have to start to heal your relationship with food. You have to start to curb your cravings. You have to start to cut things off. When they say don't drink anymore, you really shouldn't drink anymore. I didn't know this until 3 years ago. I had fallen off the bandwagon and I was drinking. And what would happen is I would drink and I would get super drunk and then I'd sober up. And I'm like, what? This is weird. And then I'd drink again, get super drunk, and then I sober up. But the next day I would wake up and I'd feel drunk. Why? Because I found out after this was, and I was doing this for like 3 years straight. Okay. I didn't understand. But what was happening is the alcohol sits in that small intestine for almost 24 hours before it actually digests because of the way your new stomach is set up. Whether you have the duodenal switch, whether you have the RNY, whether you have the sleeve, the way your new stomach is set up is it sits there and you can actually die from it. And I didn't know that. Like, I did not even know that. I would wake up so hungover. I'd wake up so sick or feel like I was drunk all over again the very next day. And it was crazy. Like, I didn't know that you could actually die because you are so drunk or you consume so much. Like, I remember one night I drank like straight shots, like straight alcohol, 32 shots, like nothing post bariatric surgery, like nothing, like it didn't even faze me. But it can kill you. Or like smoking. I wasn't a smoker, or like smoking weed or anything. But I do remember one time I did try weed post bariatric surgery and I thought I was going to die. Okay. Like, don't do it. And people don't understand that they make these commitments. And there's also a reason why you see a psychologist. People don't realize that when you have bariatric surgery, they are messing with your vagus nerve. And I don't think people really understand that. The mood swings you go through after bariatric surgery. Like, it's so serious. People don't understand there is major mood swings and mood shifts. I don't think that our bodies were really created to remove parts, adjust parts, and all of that. I think what we forgot to do was learn how to heal our bodies and learn how to heal our relationships with food, or cut things out and just stop doing them. Stop drinking, stop the sugar, stop the processed foods, and start nourishing our bodies like they were meant to be nourished. Start healing our bodies like they were meant to be healed, or start giving our bodies what and nutrients and supplements that they actually need to thrive. That's what I believe. I think that if I would have known everything that I know now, I probably never would have done bariatric surgery, because I think I needed to heal my relationship with food. I think I needed to heal and cut things out. I think I needed to change the way that I eat. Like right now, we don't consume dyes in our home. We don't consume sugars. We don't consume overly processed foods. Like bread. Why does a bread, for example, have 10 ingredients when bread should have 3 ingredients? There's no reason why you should be consuming a bread that has more than 3 ingredients on the package. Ever. Ever. Like enriched flour. Nope. Nope. Not here. Not consuming it. Um, Same thing with like snacks for kids and everything. Like if it's not a whole fruit, it's not a whole food, they shouldn't have it. Like if it's in a box and it has 10 ingredients, no. If it's not whole, they shouldn't have it. And I think that that was where I went wrong and shouldn't have had bariatric surgery, because I had a lot of complications. But if you did have bariatric surgery, like mine is irreversible. So now I have to deal with it, and I have to treat that, you know? So like when people ask me the question, like, would you recommend it? No, I would not recommend it. I can help you and tell you what you should do and what my recommendation would be. But if you did it, let me give you some tips. This is what you can do now. Buy the best supplements. Make sure that you are taking care of your body so you can stay out of the doctor's office. So you can stay away from iron infusions, because one, they're expensive, especially if your insurance doesn't cover the entire cost. My insurance, my last insurance, did not cover the entire cost. And I still had to pay $1,600 out of pocket to get an iron infusion for my last infusion last August. $1,600 because my iron and ferritin was a little low. And that's when I had to switch it up, and I found another iron that my body likes and it absorbs, and my ferritin is actually increasing. Definitely get a good multivitamin. Stay up on labs, even if you have to pay out of pocket, because doctors don't always do the labs that you need. I pay out of pocket for labs that I need so I can check what my heavy metals are. I can check what my toxins are. I can check what my liver, kidneys, pancreas, everything is doing, so that way I can make sure that I'm up on my supplements. I get B12 shots. I make sure that I'm eating whole foods. I'm not eating out. I'm not, like, I mean, sometimes you got to eat out, you know, but make the best choices in what you buy. How do they cook their food? You know, where you're eating out, how do they cook their food? Sometimes just get the meat, especially if you are a bariatric patient. Just get the meat. A lot of our vegetables here in the United States have so many pesticides, glyphosate, etc. That's going to cause inflammation in the body. It also can cause bloating with bariatric surgery. I love Brussels sprouts, okay? Red Lobster Brussels sprouts, for example, okay? Love those. They cause bloating and inflammation. I love to drink out of a straw, but there are sometimes I still get the foamies. There are sometimes it causes so much air, have to be burped like a baby. Like my husband has to tap my back to get all that air out, because I feel like I cannot breathe. So sometimes you just have to be cautious. And, you know, even with sugars, stevia, there's studies that show that stevia causes blood sugar spikes like regular sugar, but monk fruit does not. So you just have to do some research on what you're actually consuming if you want to be successful when you have bariatric surgery too. Make sure you're moving your body. Walk. Walk. I know food is expensive, but it is so much more expensive to be unhealthy. I would much rather buy the $10 eggs, yes, $13 eggs, than to buy the cheap eggs because I can afford it. I would much rather buy the eggs that are going to be better for my body and that my body's going to absorb the nutrients and the nutrients that I need, or to buy the ribeye steak, because I'm not going to eat a whole ribeye, but I can have it in increments with some eggs. And that's going to fuel my body more than going to like In and Out. Because, you know, I've been doing carnivore personally and recently to 2 In-N-Out patties, like that might be like $4, but I'd much rather buy a ribeye steak that's going to last me a couple of days and I can eat a couple of eggs. That's going to be a couple of meals and I can spend like $25 between some eggs and ribeyes, you know what I'm saying? And that's going to have much higher nutrient level for my body. Um, and I don't need the vegetables. I really don't, because it's enough nutrients for my body. Or the grass-fed butter. I know what it's going to do. That fat level is not only going to fuel my body and make me feel fuller longer, because they always tell bariatric patients, oh, fat free, fat free, fat free. But they don't realize taking away that fat is taken away from your brain. It's taken away from your cognitive function. It's also taken away from you actually feeling fuller longer. And then you're going to do what? You're going to snack. You're going to want to be snacking. You're going to want to be eating again in 2 hours, because once your body digests a little bit, you're going to be hungry again. So if you want to be successful, just be smart about how you're eating and what you're eating. You don't always need the vegetables, and always eat the protein first on your plate. That's what I say. You don't need the cheese all the time. Eat the meat first. Eat the butter. Eat the fatty things, because they're going to be better for you. Like, you don't need the fried foods either. You know, like, I do love wings, but the truth is, like, I'm not successful when it comes to like wings with bariatric surgery, or even on carnivore in bariatric surgery. I definitely use monk fruit. I try to get things that don't have a lot of ingredients. Like, if I want coffee at home, I would prefer to do like Chobani, like zero sugar, made with like stevia, versus going to a coffee shop that's going to use a syrup that has sucralose, because sucralose is going to cause inflammation in the body. I stay away from things that cause inflammation in the body. Glyphosates, carrageenan. There's so many ingredients I stay away from that are going to cause inflammation, or that are going to cause like those bubbles in the stomach post bariatric surgery. I don't know. I just think that there's, if you want to be successful having bariatric surgery, you have to really be cautious about the things that you consume. Like, just because it says zero or low carb, like, I don't do resistant starch, like keto breads and stuff like that. Like, it might be keto, it might be one carb, but do I want resistant starch in my body? Because what is resistant starch? It's just that, resistant. What do you think it's going to do in your body? You know? I would honestly like skip the tortilla or do a real tortilla before I would ever do a zero carb tortilla or low carb tortilla. Like, I would do even egg life wraps, fry those up in some butter. Those taste way better than the zero carb ones or low carb ones, because that resistant starch that they add is almost worse for you. Or like maltodextrins, know your sugars, know where there's added sugars and things, because those things add up when you've had bariatric surgery. And like, for me, like I said, I would definitely not recommend it before I would ever recommend it, but I definitely have tips for being successful. I don't know. It's so crazy to me too, because when I had bariatric surgery, oh man, my in-laws were so judgmental. They were so judgmental. They were like, just accept that you're fat. Just accept it. And now I think all of them have had bariatric surgery at this point. And not only bariatric surgery, but not everybody watches what they eat. And I'm pretty sure all of them have done the shots as well. Like, I tried, like, I won't even front. I tried semaglutide, but because of the history of NIPHS and insulin resistance, you want to know what semaglutide did to me in 4 weeks? Almost killed me. It almost killed me. It dropped my blood sugar so low I could not function. Oh my goodness. And I didn't lose a single ounce. No. So pills and all that is not for me. Even after bariatric surgery, nope. All you need to do is watch what you eat and exercise. Okay, I would consider myself a success, because in 12 years, I have not had a revision. I have not had to do shots. I have not had to take medication to continue my weight loss. You want to know what I do? I exercise every day and I watch what I eat. I don't consume a lot of sugar. That's what I do. There are some times that I've gone through gain, and you want to know what? When I have gained, it's probably because I ain't watching what I eat. That's exactly what it is. And bariatric surgery, those that have had it, like I said, I don't recommend it, but I've done it and it's irreversible. It's not a cheat. It is a tool, and you have to continue to use that tool. If not, that tool will fail you. You have to continue to eat right. You have to move your body, because in your first year or so, you will lose the weight, no problem. Because like I said, your body has no choice but to restrict itself. But if you don't do nothing with that tool, I promise you that weight's going to come right back. I promise you. And if you don't want the loose skin, you better move your body and you better pick up some weights. Okay, you can't just walk. You cannot just walk. I'm sorry, you cannot. Yes, you will lose weight doing cardio, but you need to get the weights. You need to use the resistant bands. And if your body hurts, get yourself a rebounder. Okay, get yourself a vibration plate. Move your joints. Your joints hurt because you don't move enough. Your joints hurt because you ain't stretching enough. You have to move so your body doesn't hurt. That's what you have to do. Jump a little. I promise you, get yourself a rebounder. And I promise you, even if your joints hurt now, jump a little bit. They ain't going to hurt no more. They're not going to hurt. And if you take all the crap out that causes those joints to hurt and causes inflammation in your body, remove the glyphosates, remove the processed foods, I bet if you just take out all those fruits that have glyphosates and pesticides on them and vegetables, you probably ain't going to have those inflammation in your joints and body no more either. Just saying. I'm so passionate about health in general, not just bariatric surgery, but I did want to talk a little bit about bariatric surgery because I don't recommend it. I really don't. I think it's a tool. Did it save my life or save me from something that could have been worse? Maybe yes. But like I said, I don't recommend it. I wouldn't recommend it to anybody. But I'm very supportive of those people who've had to make that decision and did make that choice and are being successful. And I give them tips all the time because I want them to be successful. They already made the choice. And to continue to be successful, you have to continue to choose yourself every day. You have to continue to eat right. You have to continue to drink your water. Don't pick up the sodas, not even the diet ones. The diet ones are terrible. Stay away from the sucralose. Stay away from the aspartame. Even the stevia, like monk fruit, sure. Sure, on occasion, monk fruit. Stevia, okay. Yeah, but I would definitely choose that over sucralose any day, any day. I know people will fight me on the whole sugar-free thing. Well, sucralose is still going to be better than sugar. No, I will take the sugar. I'll take cane sugar over sucralose, okay? Honestly. Even when it comes to that, I will take cane sugar over sucralose any day. But yeah, I would take cane sugar over sucralose for sure. So I ain't gonna go to no Dutch Bros and get me no sugar-free drink. If you got Torani Pureade, I know that that's stevia and I will drink that. But if you're gonna try to give me Torani just regular sugar-free with sucralose, nah, I'll pass. Give me the sugar, the cane sugar. I will take that over it. But yeah, and fat is not bad for you. Fat is good for your brain. I don't know where in the world people started taking fat out of things. Fat is not what makes you fat. Sugar makes you fat. Processed foods, food dyes, the things that we think are good for us is the things that are making us fat. Eating too much, not moving enough is what makes us fat. Not picking up weights, not jumping around, not using some added resistance when we're working out is what makes us fat. And if, like I said, if you don't want the loose skin, you can get some elasticity and you don't need collagen and you don't need expensive supplements. I will tell you right now, you don't need to spend money on these network marketing supplements, which that is going to be my next podcast. We are going to talk about network marketing. You don't have to spend $200 on a supplement to help you, okay? You can buy a good quality supplement and it doesn't have to be $200. You might spend a little money. It might be a little pricey, but I promise you, you ain't got to buy the network marketing ones that are proprietary blends for you to feel better. I promise you. Or to get the maximum benefit from them. I promise you, you do not. You want to know that where they're sourced from. I would say buy organic. I would say buy bovine gelatins when it comes to supplements. I would definitely say if it's not a bovine gelatin, the other ingredients, the least amount of other ingredients, it has the least amount of fillers in the actual supplement itself. Because if you have 4 or 5 in other ingredients, it's going to be mostly fillers. It's not even a supplement at that point. That's the big thing to watch out for. But yeah. And I also just wanted to touch on, my bariatric surgery for me was not ever for the weight loss. That wasn't the end all be all for me personally. It was really to have another baby and to get rid of PCOS, which I never even really got rid of PCOS pre bariatric surgery or post. It took some time. And it wasn't until I had healed my relationship with food and really cut things out. And that is a big thing. That is so big. Same thing with prediabetes. You can have bariatric surgery and still be pre-diabetic, just so you know. You can have blood work that says you're type 2 and you had bariatric surgery. So you really have to be cautious and you have to watch what you eat. So just know that bariatric surgery is not an end all be all, and it is not a cheat for those of us that did it. Like I said, it takes work and you have to use the tool properly. And just know that shots and revision are not the only way to lose if you have gained. Trust me. Trust me. I've lost and gained. With my last child, when I had gotten a little lazy, I gained a total of 60 pounds back. And I lost it all and I've kept it off for over 7.5 years. And I am coming up on, I can't math. Okay, so don't judge me. I'm not trying to lie. Like I said, I had my surgery in July 29th of 2013. So that's when I actually had my bariatric surgery. So since then, I'm coming up on my anniversary here soon. So it's been what, 11 years, 12 years, whatever. And I would consider myself a success. I am not skinny, but I do have the human body pod. And to see that my body composition changes, I was rolls. I was morbidly obese. And to know I'm not morbidly obese and on my deathbed, looking at death in the face anymore, just from obesity alone, I consider that a success. Thank you, Jesus. Like I said, I prayed over that insurance. Thank you, Jesus. I wish I knew what I knew now then, but I didn't, and it is what it is. And I know more now. And I thank God for that wisdom. I thank God for all the people that crossed my path and all the things that I've learned, all the classes I've been able to take, all the things. But yeah, if you have additional questions, feel free to hit me up here. You can follow me on Instagram. You can hit me up there. If you have more questions about bariatric surgery or you want a little bit more info on nutrition and health, I definitely plan to do a little bit more of that and get some more interviews on here when it comes to health and nutrition, because that is so near and dear to my heart. But I've talked enough on that tonight, and we will catch you in the next one, because this one was just for me. This one was for me. Maybe David will catch us in the next one too, but we'll see you next week. Have a good night.